Someone help. My daughter, please. Anyone here?
I beg you, please help us. My daughter is bleeding. He's not worth it, my sweetheart.
Enough, Maria. We'll talk later about this. She's bleeding. Where's the
What's her
doctor?
name?
Her name is Nada.
Nada, can you hear me? Nada? Nada, can you hear me? Can I look at your arms? Can you move your fingers? Can I take the bandage off? It's okay, be calm. It's a deep cut, but the blood vessels are okay. I think it might need stitches. It's better if the doctor takes a look. Please stay close to her. I'll be back quickly.
In case of serious act of self-harm, medically treat the injury. Do not leave the person alone.
This is Dr. Jamil. He will be examining Nada's arm. Nada, I'll be next door talking with your parents.
Hello, Nada. Can I take a look at your arm? Don't worry, I'll go slowly. It's a deep cut, and we need to make some stitches, okay?
Okay.
I can see that you're very worried for Nada. Can you tell me what happened to her?
Ask person and carer about current thoughts or plans to commit suicide or self-harm. History of thoughts or plan of self-harm in the past month, or act of self-harm in the past year. Access to means of self-harm.
It's her fiancé's fault. He came to visit us this afternoon and then they were fighting. He was very upset when he stormed out the door. Next thing I saw was my younger son running to me and shouting, "Mama, Mama, Nada is bleeding."
And then I run to the bedroom to find her on the bed with blood coming out of her arm. I wrapped a piece of clothes around her hand, carried her, and I ran to the center.
It must have been very scary for you.
It was horrible. Was she going to be okay? Please reassure me.
The doctor is taking care of her arm. Did you know what Nada and her fiancé were fighting about?
No, they usually fight, but it never gets that bad. They've been together for 2 years, and they're to be married next month.
Did you notice anything unusual with Nada lately?
Look for severe emotional distress, hopelessness, extreme agitation, violence, uncommunicative behavior.
No, not really. In the morning, we were talking about going to search for a wedding dress, and she was very excited. I don't know what happened with her.
In the past, did Nada harm herself or threaten to do so?
No, not to my knowledge.
If I've understood correctly, before this fight, you did not notice anything that was worrying you about her behavior.
Not at all.
I'll go and check on Nada. When I come back with her, it's important to be calm, to show her that you love her. I know that you're scared and maybe angry, but it would not hurt her if you yell at her now. When you get home, try not to leave her alone, and remove anything that she can use to hurt herself.
Like what?
Well, any sharp instrument, ropes, knives, firearms, insecticides. Don't let her access to the roof. Anything that you can think of.
Don't worry, one more stitch and we'll be done. I hope it wasn't very painful.
It's okay.
Great. I'll write down some medication for you for the cut. Nurse Hanadi will come back now and she'll talk a bit with you. Hope you get well soon.
Nada? While Dr. Jamil is writing the prescription for your medication, I was wondering, can you tell me what happened?
I don't really know what happened. I was so upset after the fight with my fiancé. I felt like the world was ending. It was hurting so much that I just wanted to die. So I went to the bathroom and took a blade.
What happened afterwards?
I felt dizzy. So I headed to the bed and laid down. Then my little brother came in and called my parents.
You must have felt very scared. Do you still feel the same now?
I don't know. I just want him to come back.
You mean your fiance? Before this fight, how was your relationship with your fiance?
I was very happy and everything was fine. We used to fight, but nothing serious.
I understand. Nada, can I ask you a few more questions? These are routine questions that we ask to people.
Ask person and carer. Does the person have concurrent priority mental, neurological, or drug use disorders? Depression? Alcohol or drug use disorders? Bipolar disorder? Psychosis? Epilepsy? Behavioral disorders?
Do you take any medications?
No,
Do you drink alcohol?
no,
Do you use any other substance or drugs?
no.
Is there any specific thought apart from the fight with your fiance that's worrying you?
No,
Were you able to enjoy things before this fight happened?
yes. I love to go out with my fiance and our friends.
Before the fight, have you lost interest in activities that were normally pleasurable?
No,
Did you feel a decrease of energy?
no, I was fine.
What else should we ask about? Does the person have chronic pain? Does the person have emotional symptoms severe enough to warrant clinical management?
Nada. Do you suffer from any chronic pain?
No,
Besides the fight with your fiance, is there anything else that might be emotionally distressing for you?
no,
Have you had problems before that made it very difficult to go about your daily activities? How about your social relationships?
I have a lot of friends and I like visiting my cousins.
Is it the first time that you hurt yourself?
I can't imagine my life without my fiance.
And how do you feel now?
I feel so scared and sad. I want him to come back.
Do you feel like you want to repeat what you did?
I just want him to come back.
What would keep you from hurting yourself again?
I don't want to worry my parents.
If you feel like hurting yourself again, what are some things you could do?
I don't know.
When you have felt very sad and distressed in the past, what has helped you before?
To talk. I like to talk and it always helps me. I could go and talk to my mother or my best friend. She always listens.
I understand. Is there anything else that you'd like to tell me? Let's go back and see Dr. Jamil and your parents.
What a relief. I'm glad you're fine, sweetheart.
Hope she's fine now. Although the cut is deep, the blood vessels and the nerves are intact. I'm giving Nada some medication, which she needs to take for a week. She needs to come to the center tomorrow so we can check the arm and change the bandage.
Thank you, doctor.
You're welcome.
Nada's going home with you. Please make sure that she'll not be alone. Nada was extremely distressed. She's still in a very fragile emotional state.
What can we do to help her?
First of all, show Nada love and understanding. Also, you could have her friends and cousins visit.
What else?
Don't leave her alone at all until I see her again tomorrow morning to see how she is. Nada, we need to talk more about what's distressing you and how to cope with these feelings, but we can do that tomorrow.
Do you promise to resolve my problems?
I promise to do all that I can to help you find the best solution. How does that sound?